Welcome to Muskegon Rising, a community service project of the Muskegon Rotary Club. Our purpose is to create lasting positive change. We've been doing that here since 1916. So, let's get started.
Hello, I'm Rem Sprague from Muskegon Rotary, and my guest today is Jennifer Baranga, and I'll talk a little bit more about Jennifer in just a second. First, I want to introduce the topic today. Muskegon has significant issues with food insecurity. We're going to learn what that means from Jennifer in just a moment. We are going to talk today about a potential partial solution that will add to all the efforts already being conducted by Muskegon's nonprofit agencies around providing food for those with food insecurity. So Jennifer, you are the Community Impact Strategist for Access Health. Now, many of you may know Access Health as a program that provides health coverage for low-income employees and their families. It's been around for 25 years and has been very successful in that vein. But you may not know that Access Health has also, in the past 6 or 7 years, served as a community convener around significant issues affecting our community, one of which is food insecurity. So welcome, Jennifer. Let's start talking about what does food insecurity mean and what does the data show about our community?
Sure. There's a lot of data that points to a lot of needs in Muskegon County. And the food issue is that a lot of households simply don't have the income to support purchasing enough food and healthy food that they need. So there are roughly 175,000 people in Muskegon County, and roughly 25,000 of those individuals are food insecure. So it's a significant need that we have here in Muskegon County.
That's really striking. We also talk about food deserts, availability of groceries in some of the lower income neighborhoods. Is that an issue here as well?
It absolutely is. And so food deserts is a traditional term. They are actually switching over to the term food apartheid in a lot of ways, because you find that it's not a natural phenomenon, right? The way that a desert is a natural phenomenon. You have a lot of areas in the county that have been heavily disinvested for a series, of decades. And so a lack of grocery stores is one of the things that you find in heavily disinvested areas.
Yeah, in your research, what have you discovered about current efforts to address this issue in Muskegon?
Well, in Muskegon County, there are a number, as you mentioned, of nonprofit organizations and a lot of churches that are doing amazing work, to help feed people. But the issue is that there just aren't enough of them. There is so much need here that there is just more demand than they can do, that they can serve. And the ability to distribute food in the county has been decreasing for a number of years. So in 2015 and in 2016, there were over 1.8 million pounds of food being distributed in Muskegon County. By 2019, that number had dropped to about 1.25 million pounds being distributed.
Even before COVID, that it was
even
happening.
Before COVID, and it's never come back. So we're putting out less food, but the need hasn't gone away, and if anything, the need has increased. Muskegon County, compared to the rest of the state, compared to a lot of our neighboring counties, we have higher unemployment, we have higher poverty rate, people living in poverty. We also have a median household income that's about $10,000 less than the average for the state of Michigan, but our cost of living here is not $10,000 less. So people are struggling. People talk a lot about families that are living in poverty. And then there are also what are termed ALICE households. ALICE is a term coined, I believe, by United Way. It's used by them and other agencies quite a bit. It stands for Asset Limited Income Constrained and Employed. So these are families and households where they're working, but they're just not making enough to meet ends meet. And the last data that came out from Muskegon County is around 43% of households in the county are struggling every month. And that number is probably on the low side. We know that especially with inflation, the way that costs are increasing. So it's about half of the households here are struggling. And certain types of households, in certain geographic areas or certain household composition are struggling more. For example, female-headed households with children, 4 out of 5 are ALICE level.
Oh, that's really striking.
Yeah. And so you have a lot of food insecure children here as well, which is not something that we want to see.
Right. So I had the opportunity to attend a community forum on the concept of a food club. I found it fascinating and potentially a very substantial contributor to the needs in Muskegon. Can you describe what the concept is, the food club concept?
Yeah, it was a model that was developed in Grand Rapids. So Community Food Club in Grand Rapids was the one that originated the model, and it had 3 goals. They wanted to increase food security, they wanted to increase financial stability, and increase healthy eating. And so a food club is designed to serve, a low-income or food insecure household. And the model's been successfully replicated in Ludington and in Holland. There are other food clubs in development around the state, and also Love in Action Tri-Cities opened their food co-op last year, which works the same way. And so a food club is it's a membership-based nonprofit grocery store. And an individual buys a membership just for 1 month, so not a long-term commitment. Many people that are food insecure are insecure for a short period of time, seasonal employees, after a layoff, something like that. So it's 1 month at a time. When you purchase that membership, it is anywhere from $5 to $19 a month, based on household income and which food club you're talking about. Because each food club, it's not like a standard franchise. It's not like a McDonald's. They've been replicated, but they're individual to the communities that they serve. But once you purchase that membership, then you get a series of points that you can shop with. You can spend them all at once in one day, or you can go in every day until your points are gone. It ends up being about a week's worth of food that you can purchase. It looks like a regular grocery store, like a little smaller, but you have all of your main staples in your food sections. You have a produce section and dairy and meats and your canned goods. You have checkout lanes. So the experience is not like a pantry experience. It's just like a grocery store. There's choice. But the main difference is that the produce, the fresh fruits and vegetables, are the lowest number of points. So what you end up with there is you have a model that allows for choice, it allows for dignity, and it incentivizes healthy eating.
Yeah, so the junk food, if you will, costs more points per package than the healthy food, produce, and that sort of thing?
Yes, and so they find that over time, as members join the food club, that they tend to increase their purchase of fruits and vegetables because people are smart and they understand, and so they really do end up purchasing more. They also do help usually with education. They give recipe cards. They help people know how to utilize those fruits and vegetables, and so there's an education component as well. And again, each one is a little different, but they all also provide information and access to other resources because households that are food insecure are also usually, in need of other resources as well.
Absolutely. So it seems like Muskegon's late to the game. What was the stimulus to bring it to Muskegon?
Actually, the Community Food Club in Grand Rapids in 2022 sought and received a grant from the Michigan Health Endowment Fund. They were looking at supporting their replication efforts because not only had they replicated a few times, but all of the food clubs were receiving calls from all over the country for people that were interested in the model. So they wanted to try and see not only to help some, communities open a food club, but sort of to document the process and to really fine-tune what, support for replication looks like. And they worked heavily with Feeding America West Michigan. So Joseph Jones, who is, I apologize, Joseph, if I butcher your job title, I'm Director of Strategic Initiatives and Partnerships, I believe. So he looked at the data and tried to identify nearby communities that could really benefit. And so there are, in addition to the stats that I mentioned about, the need here with the number of food insecure individuals, our food rescue system, even though there are fantastic organizations, the composition here is not what Feeding America considers healthy. So for a healthy charitable food system, they would expect that 50% of the food being distributed approximately would go out through agency pantries. But here, especially so many of the pantries were smaller and affiliated with churches, which, have been struggling, many of them over the years. Membership is down, donations are down, and volunteers are down, particularly since COVID. So we've lost a number. For example, Sacred Heart closed last year. And so in Muskegon County, 70% of the food going out is going out through mobile pantries. So in addition to the fact that we're putting out less food than we did, the system here, the charitable food system, is not as strong as it should be in terms of the composition.
So a mobile pantry would be like a food truck?
Mm-hmm.
So they're intermittent. They're not consistent. They're not present day by day. And so they're a little more challenging for people to access than like a food pantry or a food club, which is open usually 5 days a week, certain predictable hours, and people can shop and know when the food is available.
Yeah, so food clubs that are open, I believe they're open at least 5 days a week. They might all be open 6 days a week. Again, with those extended hours, it's part of that grocery store experience. It's part of that access piece. And yeah, so food trucks, some of the locations I believe have them twice a month, if not they're once a month, where they come through. And so yeah, they, like I said, they're doing a fantastic job, the organizations in town. There is just too much demand for the distribution that's happening.
You used the term, I think it was food recovery. Was it like
well, there is
gleaning,
food rescue,
for example? Is that how Feeding America works, or do they just source their food directly from farmers, or how does the food supply work?
I think there's a little bit of everything. And so that is one of the things that we are hoping to do with bringing a food club to Muskegon County. So Community Action House is the one that opened the food club in Holland, and they have a food club and opportunity hub. They also opened Lakeshore Food Rescue. And so
Food rescue, that was it, not food recovery, right.
And their efforts have been extraordinary. So in 2023, Lakeshore Food Rescue out of Community Action House rescued over 2 million pounds of food.
Where does that come from? What do you mean rescued?
So it comes from a variety of places. So they work with existing grocery stores. So the Meijers, I know, Sam's Clubs and, Costco, larger organizations, smaller grocery stores. And what they've been able to do, so Feeding America has the large truck, so they do work with especially those larger places. And in Holland, they've been able to expand, so they have smaller trucks. They're going out every day, so they're getting more food from the same places, but they're also able to pick up from convenience stores, that often have produce. And so a lot of those smaller venues. I'm not sure how much they're doing with restaurants yet. I'm not as familiar with the intricacies of their food rescue operation, but I do know that they have increased the amount of food that's being donated and rescued in Ottawa County, which is in contrast to most other areas, counties that Feeding America West Michigan serves, and nationwide where food rescue and donations are largely going down.
So some people might think food rescue is food that's spoiled, that can't be sold anymore. I'm sure that's not the case. Can you help clarify that?
No, it's just an excess of food that's available. And you mentioned farmers markets and gleaning, and so that is one of the areas that I know that they're doing through Holland. I know that Love in Action Tri-Cities is doing that, where going to the farmers market, you have a lot of farmers there, a lot of wonderful fresh produce that just doesn't get sold. So some of that is purchased at the end of the day, at often a reduced rate, but it is therefore not wasted, and it helps the farmers out as well. They do work directly with farmers oftentimes as well. I know Onelia Gronstall, who's the executive director at Lakeshore Food Club up in Ludington. She's got relationships with farmers, and there's just a lot of food that gets wasted. I believe nationally, up to 40% of food gets wasted. I would have to verify that statistic, but it's a significant amount of food waste in the system.
So in Muskegon, the food pantries that we have and the food trucks, they're still not capturing all the food that could be rescued.
Correct. And they are, and it's also a burden on those agencies or individuals. Many people in the county, I'm sure, are familiar with Judy Clark Oakes, who helps with First Congregational Church. She's been a core member of our work group here to bring a food club to the county, and she's at Aldi every week with her van, picking up food and doing that herself. And, at Salvation Army, Bridget Larson is doing that, and her volunteers and picking up the food. And if we could get an established food rescue operation, it would really support those organizations.
Yeah, so you're not coming in with a food club to compete with others who are already providing services as part of their mission. It sounds like it's truly additive and supportive.
Yes, we would never want to take away from those food pantries. Again, I've mentioned they're doing extraordinary work, the nonprofit organizations, the churches, all of the volunteers. And it's a food club that we could bring here would do two things. Again, as we've talked, it would increase the amount of food going into the system to, and facilitate that process as well. But it would also reduce the demand on those organizations. The Community Food Club in Grand Rapids did a study. So after 6 months of having a membership there, around a third of their members reported not having to need those emergency food resources. And so here in Muskegon County, again, there are 25,000 roughly individuals that are food insecure. Food clubs, again, we would have, as we build one here, we would have a lot of choice in terms of those fees, those membership fees, and who we would serve and all of that. The existing food clubs primarily serve individuals at around 200% of federal poverty level or below. And so here it's about 75% of those food insecure individuals are in that range. So we would be looking to serve potentially around 18,700 families. Or households, or individuals.
Yeah,
sorry.
That's remarkable. So where are we in this process of developing a food club for Muskegon?
We have been working, again, we connected at Access Health with Community Food Club in Grand Rapids through their grant 2 years ago. And we really have been making sure that we're building a solid foundation to try and make that happen. So we had a lot of conversations with existing organizations early on because we wanted to see if anybody wanted to take that on. Because there's different ways to open a food club in Grand Rapids. They created a new entity. You know, it was primarily 6 organizations, I believe, at first that came together to develop this model, formed an LLC first, and eventually a nonprofit. And they were under the wing of another nonprofit organization. In Holland, again, it was Community Action House that stepped up. They had been a food pantry. They'd been around for 50 years, and they had the ability and the desire to take that on. So we originally explored that. Had some groups that were interested. Eventually, nobody stepped up to want to do that. So we had a few different things at Access Health. We also got a grant from the Michigan Health Endowment Fund to do participatory food asset mapping. It's something we'd love to do countywide. We started in the city of Muskegon Heights and did 7 sessions with over 100 community members and food entrepreneurs. And as part of that, we did that in 2023. We presented the idea of a food club model to see how community members felt about it, and they were incredibly receptive to the idea. We then hosted our first food insecurity roundtable event in April of 2023. We had a lot of agency representatives and community members there. And so after all of that, we started pulling together in meetings in August of 2023 and have been going about every 2 weeks since, on average. We have put out an RFP in December of last year to get help to create some planning documents. We felt that the food club was a fit here. We knew that there was a need, but we really wanted to more closely assess the fit of that model for Muskegon County. So we contracted with New Venture Advisors was a group that we selected that replied to the RFP. They're based out of Chicago, but they have a consultant in Grand Rapids that we were working with, Andrea Carbine. She was the one that presented at our event. So they completed a needs assessment for us, looking at that fit. That was done in August. It is available at our website at Access Health. We have a page dedicated to the food club project. So anybody can go take a look at that. Now that that's done, and we've seen that, yes, it really looks like it would be an ideal fit for the area. We are moving into with them. We've contracted with them to do an operations workbook and concept model. So we can really look at where the food will be coming from, what type of food we'd be looking at, and the volumes where we would get it, and get some costs. We want to evaluate up to 3 potential sites. So we have some folks identifying those, so we can do costing model, what it would cost to open a site, what that would look like, what the operational costs would be. We have also contracted with Nonprofit NAV, a local group that's helping us with that governance piece as we come together. Right now, we're looking at creating a new entity, and Access Health is a fiduciary for that. We're supporting this project in that way. We're looking at branding, what do we want that entity to be? What do we want to call this project? And, so start looking at that funding piece to bring more dollars in as we move this forward.
So this is going to be a tough one for you. What's the earliest you think we could have a food club up and operational in Muskegon?
I don't know the answer to that for sure. I mean, we're looking a couple of years out. We will have, in March, we'll have some dollars. We'll be able to know some figures, say for 3 different sites, what it would cost to open the food club, to get that facility open, and what those operational costs would be. And at that point, probably do a specific capital campaign feasibility study. Again, we want to make sure that we're on really solid footing with this project. We're bringing more people to the table. Our work group, and again, there's a core dozen of us. We've had dozens of people and organizations evolved in supporting this over the last couple of years, but there's really been about 12 to 13 of us that are coming together. And so we formed 6 different subcommittees that we're branching out. We have governance committee looking at, building this organization. We have fundraising, communication, outreach, sites and facilities, and that food rescue and sourcing. So we're trying to get more people to the table. We have monthly meetings. We're starting to meet on the second Friday of every month. Now on January 10th is our first. It's 9 to 11 a.m. at Muskegon Community College. Everyone is welcome. We meet in room 2323 in the Stevenson Center, and you can reach out to me or any of the other organizations involved. I could list off some names if you wanted to come and join us. And
I
support
strongly
that.
encourage people to consider attending. You'll learn a lot about it. It's a very complicated process, but it's so needed in Muskegon that I really hope and pray that this will be successful.
Thank you so much. And again, if you don't mind, I do want to throw out, because I know that Muskegon is kind of a small town, right? And so there's so many people that probably know some of these folks at the table. So our core work group is Bridget Larson from Salvation Army. We have several individuals from Mission for Area People. So we have Brittany Brown and Kristen Turgeon, Vondi Woodbury, who's on your board over there. Again, Judy Clark Oakes, whom I mentioned before, Joseph Jones that I mentioned before, from Feeding America West Michigan, so not local, but an important part of the group. We have Kendra Beckstrom from Kids Food Basket, Emily Merton from the Community College. The Community College has been a big supporter. Dr. John Selman, the president there, has been fantastic, really believing in this project. We have MSU Extension, so Aditi Kulkarni over there is at the table. We have West Michigan Works, Larry Sanders and Tara Becker. Andrea Copeland from Lakeshore Flavor, Lionel Alexander III from Public Health, Muskegon County. And I just wanted to throw those names out because each of them are just as integral to this project as I am. And they all have great information, and you can reach out to any one of them to learn how to join.
It's a really strong and diverse group of supporters.
Yeah, I'm really proud of the work that they've done coming together. And Muskegon is very collaborative. I think it's one of our strengths. And this group in particular, like as you mentioned earlier, Access Health does a lot in the space of alignment and collaboration, and this group has just been outstanding.
Yeah, you're absolutely right. Muskegon is known far and wide for its collaborative culture and all of the things we've been able to accomplish. So here is Jennifer Baranga. So glad to have you today talking about a food club concert to address food insecurity in Muskegon, a really exciting project that I will wish you all the best.
Thank you so much.